Good afternoon. Good afternoon. Welcome. Michael here, Deeper States Mind and Wellness. How is everybody? I hope you're all having a great Thursday afternoon. And as you can see, we changed our times, hoping that we can get more people on Facebook involved. We get a lot of people on YouTube, but I'm not really focusing my energy on YouTube, which I should be, but it's kind of tough keeping everything going, especially now I have a new puppy. It's been kind of out of control. Anyway, I want to touch base today, and today our topic is going to be what hypnosis can be used with. For what medical conditions you can use hypnotherapy with. The interesting thing is that there's some gray lines, and I want to kind of cover that a little bit, but give you guys a little background on who I am. My name is Michael Almers. I'm a clinical hypnotherapist. I use neurolinguistic programming as my main form of success. I've been in practice for over 25 years, and I just want to touch base on what people think hypnosis can be used with, and what it can't. I want to tell you some of the things that I have used hypnotherapy with, some of the things that I have been able to have great successes with. And I think it's different for each hypnotist. I mean, you have to know, each hypnotherapist has to know what they're comfortable with. Being a neurolinguistic programmer, I go after the neurology, how the brain operates, or how it sees something, or how it's taking emotions and running them through the unconscious level into your neurology. So for instance, a person who's having depression, the key is going to be to go in, get the depression, find out where the core root of that is, and then find the emotional state and switch that emotional state into a positive state. I've worked with hypnobirthing, so it's great to give birth to a child with hypnosis. If you're looking to not necessarily, not having a painless childbirth, because we can't really say that it's going to be painless. But let me ask you this question. So if you were to have a childbirth that had very little discomfort, now that changes the whole mindset, doesn't it? So the key element is going to be that we first help the brain understand what it is that hypnosis can do and what it can't do. So first of all, there has to be a belief system stating that I'm able to help you, an agreement, right? Whether that's verbal or actually a signed written agreement. But a lot of times verbal agreements are very, very important. Without a verbal agreement, the client's not going to go into trance. But when you're doing hypnobirthing, the key is to, first of all, remove the worry or the pre-created understanding that childbirth is painful. I mean, look, you go into Asian countries and you'll find where, they'll be out there working on the rice paddies and they're forced to have the baby and then go right back to work. Thank God we're not like that in this country, because here they give you some recovery time. They take the time to help you through birthing. When we get the hypnobirthing working, as you saw with my interview with my client Pakoya, who came on a live with me, the hypnosis worked so well that she had zero pain. So she didn't know, the hospital didn't know where the baby was at. They did everything within safety parameters of the child, but the child actually had the umbilical cord wrapped around his neck, and they didn't know that. So childbirth is you can go as long as you can, and you can't go, and then you can't do more. But it's better to have a comfortable childbirth as opposed to having pain related to the process itself. Stop smoking, alcohol and drug recovery. I'm gonna give you a little bit of differences with that. So stop smoking is easy. For me, that's easy. For some therapists, they don't like it. Going into core root, core evaluation, finding a way to be able to leverage yourself from the negative into the positive. And we find that in the pre-talks. But a lot of times you don't want to use hypnosis with a person who's using heavy drugs, having hallucinations, because then the brain does conjure things up. I mean, even when you're in meditative state, whether it's hypnosis or just getting, sitting there meditating, under hallucinogenic drugs, the mind can go in, the unconscious mind can start creating delusion, right? So we do not work with people that have had heavy drug use in the past or that are having heavy drug use now. Now, alcohol is a different story because, yes, a lot of times it's hereditary, but let's talk about that for a moment. If something's hereditary, doesn't necessarily mean that it's going to be something that has to be guaranteed in this person's life. Absolutely not. I think that we can go in the unconscious mind and change those behavior patterns. And some people tell me that with depression and anxiety, they'll say, well, My whole family's had depression, so therefore I have depression and I'll always live with depression for my entire life. Well, fine. If that's what you believe, perfect. Good for you. If you believe that, then let's get in a mindset where, okay, so you have depression, let's deal with it on a level so that it doesn't ever become this panic attack, this I can't get out of bed today. Let's work on it so that it's not that massive impact in your life that just it makes you not function, right? But I do believe that if we can find the core factor of that, even if it's just emotions, the core emotions that you feel when you're having depression, we change the state of your body, we change the state of the mind, and get the mind on an unconscious level through hypnosis to get to change those patterns or those behaviors that the brain has become accustomed to. The reason that you don't want to use hypnosis with somebody who is having a psychotic episode is because it can make it worse. It will go in and you're giving them suggestion. The unconscious mind is very analytical. It takes things very straightforward. So, if they're having hallucinations and that's what its belief system is, that's what the unconscious mind's belief system is. You start feeding suggestion into that type of a episode, then it can turn into hallucination that is negative hallucination on behalf of the client. Another thing that we say is, physical disorders. So, if you're suffering from a physical disorder, let's say that you broke a leg, or let's use broken leg for example. I had a friend a long, long time ago who's no longer with us that had broken his foot, and he had asked me to do hypnosis with him. So I did some pain reduction with him, and this was I was very first starting. I had got a doctor's referral, and he chose to walk out that night and go to the bar because he had no pain. And it caused breaks, all in through the bottom of his foot. I think it went from one fracture to like 3 fractures in the bottom of his foot. What I learned from that is that, when you're going to do hypnosis, you have to have a doctor's written order, or you have to be able to have the authorization from the client to work with them, because he had an authorization, but I did not know that the outcome would be that he would go to a bar that night and go drinking. So yeah, so it's important to be able to be cautious of what you're doing. That's why, here at Deeper States Mind and Wellness, we always do a pre-talk or a strategy call in order to find out what's going on with the client, whether we can really assist them or not. I mean, I don't want to take on a client that I'm not going to make a difference in their life for them. Another thing that you want to know with hypnotherapy is that a physical disorder can't be corrected. So I could not have fixed his broken foot, right? So if somebody has a broken leg, that you can't fix that. I'm going to go into surgical procedures in a little bit, but if somebody has a broken arm or a broken leg, you can reduce their pain. Remember, the brain is that strong. I mean, we talked a little bit on another episode about when a client gets into a situation where maybe the car's rolled over on top of them. You've heard those stories where, the adrenaline rush and the whole process of the body going to that fight or flight is able to push that car up and get it off of their body. Well, that's the same thing that happens in hypnosis. I mean, your brain is that powerful, right? You get in there, the body starts going into homeostasis state. It starts to try to make the equal match the interior, so the inside matches the outside matches the inside. Tries to find that center point of healing. So we want to be able to get to that point, and we want to be able to change the pain levels by, first of all, getting the client to know that they can increase their pain, but then also getting them to know that they can decrease their pain. And as they decrease their pain, then they get to where they're understanding that because they can take it up, they can take it down, right? Kind of basic, but it's basic for the brain. And remember, I said the unconscious mind is very analytical. It takes things for exactly as they are. So I did a stage show one time where I had somebody forget the number 4. And during that, I said, the moment when you open your eyes, you realize that the number 4 is just completely gone. So when I had that client come up on stage, that participant, I said, "What's your name?" And she says, "My name is," because the analytical part of the brain caught that, rearranged it, and made that become her name. So when we're doing pain reduction, it's really, really important to make sure that you know what you're working with. Make sure that you can reduce the levels of pain by first giving them the power to know that they can increase the pain, and then get them to start minimizing it. So it's kind of like if you ever burn your finger on the stove, and you're very aware of it at first, and as you kind of ignore it and let it go away, maybe you put a Band-Aid on it, by the afternoon, it's already kind of gone. You're not thinking so much about it, and the pain level's reduced. And then when somebody gets really, really burned, it's kind of crazy because they get in a car fire, they go through the fight or flight feeling, And eventually the brain and the body and everything just start to overcome that, and they don't really feel the burning of the pain. It becomes almost like a deadened sensation. Uh, and thank God, because otherwise the brain would go into an overload and it would realize what's happening and it would want to shut down, and it would go into this whole process of shutting down, causing the body to want to shut down. So the key is that, thank God we have these built-in mechanisms in our unconscious mind. So hypnosis can be used for a plethora of things as long as it's not physiological. Because I can't heal the broken leg. We can't. Hypnosis is not going to fix, the kidneys that you have that are failing. But can we reduce the pain of those kidneys? Absolutely. Can we get the brain to get the body to heal faster? I believe we can. And the reason I say that is that you think about this for a moment. So overnight, so let's say you burn your tongue, or you get a cut in your mouth, right? Overnight, you wake up in the next morning and it's starting to heal. And I think that our unconscious mind, I believe that our unconscious mind during that rest period, during the sleep period, puts you in the homeostasis state, and the body starts to go into this healing mode. Well, I mean, why can it not do that with the rest of your body? So if you're fighting cancer, why can we not get the brain to go in and start seeing the reality of being able to reduce those cancer cells, to eliminate them, or to get them to kind of shrink down a little bit? The brain's pretty powerful, isn't it? I mean, I think that can, if the brain can see it, it can conceive it, right? And I really do believe that's true with illnesses as well. Um, Physical disorders, that so even the ones that require surgical treatment, you're not going to change that. But can you change the pain levels of that person going in to have their treatment done, have the surgery done with less pain, maybe less anesthesia, right? Absolutely. My friend, who is a very well-known hypnotist here in Orange County, Scott Sandlin, he owned a practice just based on going into dentist offices, reducing his clients' pain and promoting healing. And he ran his entire practice on that. Now he owns one of the largest associations in the country, actually in the world, and he's done very, very well for himself. And he's awesome, awesome, awesome person. But the interesting thing is that he was a proved factor that you can go in and you can reduce pain without anesthesia. I mean, I've had a wisdom tooth removed without anesthesia. Not wisdom tooth, a root canal done without anesthesia. They did very little anesthesia, just enough to get it to start numbing a little, and I did the rest through hypnosis. I did eye surgery. I have glaucoma. They put two blebs in the top of my eyes, these little pockets that look kind of like a sump pump. So when the liquid fills, it gets to a certain point, and then the bleb opens and it releases that liquid back into the inside of the brain, and it starts to put it back into the eyeball. So that was a procedure that was done in an office because they didn't have the insurance wasn't wanting to cover the next needling or cleaning out of those blebs. So the doctor, who's a good friend of mine, asked me, Michael, would you mind doing this? We can do it here in the office if you're willing to go in and do hypnosis and kind of get the pain levels to come down quite a bit. And if you can't take it, we'll just stop, and then we'll find a surgical center, and then you can just pay out of pocket for that. So I was like, sure, let's give it a shot. And she kept using me after that for patients that could not come in and that had this fear of having the initial needle put in to put the numbing gel inside the eyeball and to get the liquid anesthesia into the eyeball. So it did great. Does awesome, awesome processes with that. But yes, hypnotherapy can be used with very, very, very many medical situations that you're going through, even just to promote healing. The brain can be cued into promoting the healing, getting the white blood cells to move into that area and to start working on minimizing or treating whatever is happening. I had a client that had a quadruple bypass, and they told him it'd be a year before he went back to work. So I set him up with one of my contacts here in the Long Beach area who owns a pretty big studio where she works mostly with Olympic and junior Olympic athletes, and she has a hyperbaric chamber. So we were doing hyperbaric chamber and hypnotherapy and getting him to see the heart rebuilding itself, becoming strong, beating beautifully, powerfully. And it's interesting because he ended up going back to work 6 months after seeing the both of us and having no problems after that. It's very interesting how the mind over matter is huge. I mean, if we can get the brain on the right sequence for healing with the body, then yes, I think we can use it medically. So in 1968, the American Medical Association looked at hypnotherapy, and at that point, They did not have enough research to be able to say, oh, yes, it can or can't do this. But what they did go ahead and vote it in as being adjunct therapy to healing and to working with the body and getting people to use it for their mindsets and to change their mindsets to achieve goals and reach other levels of success. I'm going to go in. I'm going to trade this over now. If you're joining me and you want to leave a comment, or you want to comment from Instagram or from YouTube, from Facebook or from YouTube, there's a link on the bottom rolling over the screen. Just click on that link. It'll let you ask a question. I'm going to go into the comment area and see if we can get some questions coming in. And if you do, I'll answer them. Otherwise, you know what, you guys, share this if you like it. If you're wondering about doing hypnosis and you were kind of worried about it, or you're scared, or you're wondering whether or not you could use it with your own, medical conditions that are happening to you right now, the answer to all of that is yes, yes, yes. But, and there's always a but when there's a yes, right? The but is that you have to really make sure that that the hypnotist is versed in NLP. That's the biggest thing I'll always tell everybody. And make sure that they have had several years of at least doing what they're doing, and that you have a rapport with them. A lot of times what happens is, you go to sign up for this therapist and you think, oh, this sounds like the greatest person ever. And then you just don't have a rapport. And that's kind of tough. It's hard to follow through with a program that's you're not meshing. So that's kind of the worst thing you can do when you're looking to heal and you're now dealing with somebody who you don't get along with, or who you just feel you're not on the same page with each other. So always ask for an interview or a consultation. You might have to pay a little bit for it. I mean, we charge $85 for ours. Once you do join one of our programs, that $85 goes towards your program. But I think it's important to build a repertoire with your doctor, with your hypnotist, with your psychiatrist, with your sociologist, with anybody you're working with. If you're going in for colonics, you want somebody doing that you're going to have the same rapport with, you're going to get along with and enjoy and like, right? I mean, things sometimes aren't comfortable, and the same in hypnosis. I'll tell you that when we're working with medical conditions sometimes, and any condition really, sometimes something will surface and it'll be an epiphany of like, oh my God, I feel this way because of this, or, I'm really worried about healing through this bypass because my mother had a bypass and she passed away 2 years after the bypass, and I've been having a lot of problems with it. A lot of that sometimes psychological mindset can change the way your healing process goes, and it's really important to be able to find that if the healing process isn't working, start adjunct therapy and get other things going. Create a plan, right? And see if your plan can help you move through that process and get you feeling better and get you achieving more with your healing. Looks like there's a YouTube question. Does hypnosis make a difference is hypnosis different than the hypnosis that you experience on stage? Does it make a difference? Does it make a difference? I think it means, does it make a difference if you're on stage or if you're in a clinical practice? So we no longer have physical offices. What I'll tell you is that on stage, you'll just have stage hypnotists that'll do just a show, and it'll just trigger something in somebody's brain, and they'll be like, oh my gosh, I'm different. Something changed for me. I feel this outlook on life has changed for me. And the reason is because it's all therapy, right? Laugh therapy, hypnosis therapy. It's all getting into the unconscious behavior of how things operate. So the difference between being on stage and being in a clinical office or being on an online session with me is that there really is no difference. Things have to happen. You have to volunteer in order to be there. You have to want the change, or you have to want to be hypnotized on stage and have a good time, right? And there has to be some kind of an agreement. For a stage hypnotist, the agreement is that you walked up on stage. For a clinical practitioner, the agreement is that we had the strategy call, and I now believe I can work with you, and you're really ready to move forward. We'll move forward. You'll get your paperwork, you'll sign it, you'll start working with me. Some people, coming into the office, a physical handshake is the beginning of the contract to say, yeah, you know what, I'm willing to try this. I'm going to be open to this. Let's go for it. Because nobody can be hypnotized if they don't want to be hypnotized. That's one thing I always tell everybody, is that hypnosis is self-hypnosis, right? All hypnosis is self-hypnosis. So if you're being hypnotized all the time, right? We're being hypnotized by all the effects of inside and outside stimulation. Sometimes what happens is that you're getting the effect coming in from negative hypnosis, whether it's your parents and you're young and you're sitting at home and you're still not the age to leave. you could be getting negative hypnosis, and you're in a negative state trance, and that leads on to negative state trances for the rest of your life. It can. And same with good trance states, right? We're in trance all the time. So if you're getting a good trance state, your parents are saying, hey, you're doing a great job. You did your best, try to do better next time, but this is pretty good. Now, what can you do to change that and make it even better? That's a positive trance state. So language pattern and how we're hypnotized is all based by outside surroundings, mental, emotional, physical. So every time you go into, let's say, a grocery store, you feel really cold and you just feel kind of sick, and who knows, maybe that's connected to something else from your past. That's going to continue until that trance is broken, until that continual tape is looping in your head, and until we splice that tape and you go into the unconscious behavior, whether it's through a psychiatrist, an MFT, or through hypnosis. Talk therapy is awesome. It's powerful if the client's ready, willing to make change, right? Or willing to even listen. I mean, a lot of times people will go into these sessions with a psychiatrist or a hypnotist, or usually a psychiatrist and an MFT, and just talk, but they'll reserve what they don't want to talk about. They'll just go through their life and never ever say what's really going on in their life. So the therapist only can work with what's being given to them. Same with hypnosis. If you're not transparent with me and you're not giving me tons of understanding of where you are and what's going on, then we're not going to get past that. We're not going to get you to move forward. Man, I'm getting a lot of pixelation today. It's interesting because I'm used to doing this early in the morning. And I'm wondering if it's that we just have so much bandwidth being used during the day or what. But anyway, yeah, there's a lot of pixelation going on in my head. We'll make some changes, see if we can correct that a little bit. But we have another one. YouTube is asking, when a client goes into hypnosis or into trance, do they feel any different than when they're in the waking state? So it's interesting for that question. Thank you so much for that question. It is a good question. So a lot of times people feel like the sense of kind of detachment. They might feel like they're floating. They might feel like they kind of hear me sometimes. Sometimes they don't hear me, like a waffling effect, like they're in the waffle, out of the waffle. Sometimes they may not remember anything. It might be just like a deep sleep. But remember that everything is hypnosis. So no matter whether you're in sleep state or wake state, the unconscious mind is still listening, right? So I always like to use the adage that if the fire alarm goes off in your room in the middle of the night, are you going to hear it? Yes. Will you wake up to it? Yes. Will you sit there and think about what it is initially? Absolutely. But you're still going to hear it, and the unconscious mind is going to go back and say, "Oh, that's the fire alarm." So in hypnosis, you're still very aware of the suggestions that are coming into the unconscious mind. Now, remember, I talk about this all the time. The unconscious mind is only going to accept what it believes, right? What it thinks is good for it, or what it's learned along its pathway of life. So, if I give you a suggestion, or a hypnotist gives you a suggestion that is not coherent with you, or not doesn't fall in your life plan, right? um, the unconscious mind, the cognitive filter in the unconscious mind is going to spit that out. It's not going to learn it. It's not going to take it. It's just going to acknowledge it and be like, that's so weird. That wasn't me. Why is he talking about that? Or why is that even being brought up? That's not me. And then it'll just go ahead and it's going to just get rid of that. So I want to show you a video when I close today of a talk that I'm doing. I'm doing a talk coming up called "How Can We Live How Can We Feel Safe in an Ever-Changing World?" And we're going to talk about kind of what you need to do, how you can get a mindset that helps you move forward. A lot of people are really stuck right now, all the way from not wanting to go out because they're afraid of walking out without a mask, all the way up until, I just don't need a grocery store. I can sit on the couch all day and I'm really comfortable here because it's a scary, scary world outside. So I'm going to be speaking at an organization May 4th at 7 p.m. And I invite you to come in. It's a free talk. You can ask questions in there. It'll be a Zoom talk. You guys can ask questions. You guys are able to participate with me. And let's talk a little bit about that. But I'm going to show you a commercial that was made for that we're actually using to send out for people to know about this class. And once again, I want to thank you guys. It's been 30 minutes, and I just want to kind of give you a little bit of the topic. And if you have any questions, please DM me. I'm open for any kind of questions. I will answer anything you guys have to ask me, hypnosis related or not. I'll give you my best answer that I can, and hopefully it's right. If it's not, then we'll find out, and we'll both learn the answer together, right? So it's Friday, it's Thursday. So I want you guys, one more day before you get in there and hit the weekend. I did a challenge on Facebook, I think it was. I'd like to know. So last weekend, I paid for somebody behind me at Pollo Loco, paid for their food, and just a kind of a surprise, just something to give back. I'd like to know what you guys are going to do this weekend for somebody who you totally don't know, a stranger. And that's just something I did. You guys can do something else. Maybe you can't afford paying for somebody else's meal through a drive-through. Maybe, it's going and buying a flower from a vendor on the corner and just giving one flower to some lady who looks like she's sad and just say, I hope this makes your day. I challenge you guys, go out there and make somebody's day just a little bit special and do it unconditionally. Thank you guys. Michael Elmers here, Deeper States Mind and Wellness. I appreciate those of you who are over on YouTube, Facebook. Let's grow this. When you guys watch replay, it's going to be now every Thursday at 3:00. I think it's easier for me because I'm not a morning person. And when I wake up in the morning, I got a lot of shit to do. So this would be just a lot easier, I think, for everybody. Take care. Thank you guys. And I wish you guys an awesome weekend. And again, like I said, go out there and make somebody's day special, and do something different for someone else. Thank you guys.
I think these videos are brilliant, and I'm sure you will like them too. Please like, comment, and subscribe, and don't forget to click the notification bell.
Hi, how are you? Michael Elmer is here with Deeper States Mind and Wellness. I know it's really difficult to feel like you can be comfortable in an ever-changing world. But we've passed through a lot of stuff in the last 2.5 years, and our future is just waiting. It's waiting for us to go in and live it and take opportunities that are waiting for us. It's all mindset. I've been a hypnotist and an NLP practitioner for the last 25 years. I've helped clients not just change their life, but to be able to understand that at the worst times, you can find what's beneficial to you, what's important to you, and grow off of that. So I look forward to presenting at your group, and I am so excited. I can't wait. Thank you guys. I forgot. I almost didn't show that clip. So so the talk is free. It's May 4th. I put the link down into the chat group. So if you guys want tickets, go ahead and sign up for that. You do have to sign up for tickets because they want to know who's going to come in. It is a private organization that I am just speaking at, but they've given me the okay to bring people in or to welcome people into the talk. So anyway, thank you guys so much. Have a great afternoon. And again, have an awesome weekend. Bye now.